Hello, everyone. My name is Dr. Dawn Hayford. I am here with Taylor Hayes, a wonderful psychedelic nurse, founder of International Association of Psychedelic Nurses and the Hope Health Network. We at Grassroots American Magazine interviewed Taylor a few months ago, which you can read that interview in the September Plant Medicine issue that is just coming up. And we are here to catch up with Taylor and everything she's doing since the last time we talked to her. How are you, Taylor?
I'm very well. Thank you so much for having me on today. I'm very happy to be here and to share some information about psychedelics and nursing.
Awesome, awesome. So what's new in terms of the association?
We are still growing. We're growing and growing. We've had lots of interest. And lots of nurses are very interested in psychedelics, and we're preparing, more and more educational opportunities are coming out, and it's really expanding and continuing to grow.
Wonderful. And your Hope Health Network, which connects patients with a psychedelic experience in a legal and safe environment with medical professionals. I know when we last talked, you were planning on launching your inaugural run in January of 2021. Do you think that'll still happen?
So currently we're closed from traveling to Brazil. So right now we can't have our January experience in Brazil due to COVID-19 travel restrictions. But we've moved now, we have another opportunity in Jamaica in May. It'll be May 10th through the 16th, 2021 in Jamaica. So you can find more information about that at hopenetworkhealth.com. And that's our Jamaican Basics course. We'll be working with psilocybin medicine and cannabis medicines.
Wonderful. And can you tell us a little bit about how you view cannabis and psychedelic medicines working together to help patients?
Well, I found that both of these medicines, the psilocybin and cannabis medicine, have many, many, many different applications. And I've seen many patients in the clinical setting get relief from these medicines. So there's many opportunities for psychedelics in medical practice, and it ranges from a very wide range of applications, from mental health disorders such as addiction, depression, anxiety, PTSD, on to physical conditions such as chronic migraines or headaches, and people who are struggling to cope with cancer diagnoses or other diagnoses like that. So it's really nice that there's so many applications, and there's so many things left to discover with psychedelic medicines and how that they can benefit us in our lives.
And you, your specialty, of course, is in psychology, and that's what you specialize in. So you deal a lot with the mental and psychological health aspects. So do you, I know you're specifically focused on psychedelics, but I assume you also incorporate cannabis as a method of that as well, not just this.
Absolutely. Yeah. So my background is in mental health. So I've been an inpatient mental health nurse for 3.5 years, and now I'm about to finish graduate nursing school. And so I'll be a psychiatric nurse practitioner here in a couple months. So I definitely focus on mental health aspects and how we can use psychedelics and plant medicines to treat that. I consider cannabis a psychedelic medicine. There are some people who do not, but I say that it is, it has psychedelic properties. So I kind of include that in psychedelic medicines.
Okay, yeah, because I know there is some I'm not going to say confusion, but some people distinctualize between the psychedelics and the psilocybin, the MDMA, ketamine, some of those other medicines versus cannabis, and sometimes there's a differentiating factor there. But as you mentioned, they all do and can have psychedelic effects that can help relieve, especially mental health issues.
Absolutely. So there's different applications and different, ways of administrating these different medicines. So one medicine may work really well for one specific thing for one person, and one different medicine may work for a different reason for another person. So it's really just, you know, what you need, what your body needs, what your symptoms are.
Mm-hmm, mm-hmm. So one of the things in our ongoing profiles of plant nurses, I'll just kind of generalize it even more. We were doing cannabis, now we're doing psychedelic cannabis and everything, right? So as you expand through, you know, cannabis and then incorporate the other psychedelic medicines such as psilocybin, what are you finding that differentiates you from some of the like pure cannabis nursing followers as far as incorporating other psychedelic medicines?
Well, what I've found is that many nurses who are cannabis nurses are interested in psychedelics such as psilocybin and ayahuasca or other psychedelic medicines, but they don't have any experience, and so they're wanting to learn and they're wanting to understand. So this is something that I guess would differentiate me in some way, is that I have experience with a very large variety of plant medicine, psychedelic medicines, and animal and fungi medicines. So I'm continually building my library of knowledge of all of these different substances and how we can find applications to medicine and to Western medicine. So I study different indigenous therapies from all over the world, different cultures from all over the world, and see what kinds of medicines that they use and how can we use that in Western medicine safely.
Mm-hmm. Yeah, and you are definitely, based on our previous conversation and interview, definitely interested in bringing the two together in kind of a, I guess, hybrid methodology, as opposed to like no Western medicine or anything.
Oh, no.
Like that.
Yeah, there's much value in both, and much of Western medicine originally came from, you know, plants or animals or fungi. So there's room for overlap, and there's definitely room to learn from each other. So I'm here to integrate both together to create a sort of holistic model so that we can get the full picture of health and the full picture of life, and to help every individual reach their highest potential and the best outcomes.
Yes, exactly. So important for people to have I think personally, to have a holistic approach to health, you know, because we are holistic beings. We're not differentiated inside of ourselves like that. So just to kind of wrap this up, what is your goal for the rest of the year, considering how much coronavirus has thrown us all off of our plans for 2020?
My goal for the rest of the year is to finish graduating with my master's in psychiatric nurse practitioner master's degree, as well as nursing education. I'll finish that up in just a couple months. And I'm also training to be a Kemba practitioner. So those are my goals for the end of the year, and to start off 2021 with some new medicine options, and to get started on Hope Network Health so we can offer this psilocybin publicly. Anyone who wants to come can fill out an application and be reviewed for a chance to come experience some of the world's best medicines.
Awesome. And we wish you all the best finishing your degree. That is a major accomplishment. So I'm going to congratulate you in advance, because I know you're going to be successful. And I hope that the rest of 2020 is fantastic for you, and hopefully we can catch up again in 2021 and see what new things you're doing at that point, and how your plant I'm totally spacing on the words right now, your experience in Jamaica goes. I'd love to follow up with you on that next year and find out how that went and what you're doing going forward.
Very good. Thank you so much for reaching out to me, and it's great to share this information. And anyone who wants to follow me for updates, you can follow me at www.psynurse.com, psynurse.com, or www.hopenetworkhealth.com.
Definitely, and we'll make sure we highlight those as well. And I'm going. Thank you again for your time, Taylor, and we will talk to you again soon.